Hi, welcome everyone. I'm Michelle Leifer, and I'm the director of the Usdan Institute for Animal Health Education at the Schwarzman Animal Medical Center. Joining me is Kimberly Young, our education coordinator, who will help moderate tonight's event, Brushing Up on the Basics, Home Dental Care for Pets with Dr. Jordan Ford. Dr. Ford was raised in West Virginia and earned his undergraduate degree in psychology from Harvard University. He worked for 3 years as a research coordinator at New York State Psychiatric Institute's Anxiety Disorders Clinic, but ultimately decided to pursue a career in veterinary medicine. After obtaining his doctorate from Cornell University, Dr. Ford completed an internship in small animal medicine and surgery at AMC. He's now a third-year resident in dentistry and oral surgery. This is Dr. Ford's third Usdan Institute lecture, and he's also given several presentations for our children's program. So Dr. Ford, again, Kimberly and I just want to say how much we appreciate all the support you've given us these past few years. And I know you have many, many fans out there eager to hear this presentation. So on that note, it's my pleasure to welcome Dr. Jordan Ford.
Excellent. Thank you so much for having me back. It's been great. I'm not a confident public speaker, but it's been great practice, and I thank you guys very much for letting me commemorate each February being Pet Dental Health Month. This is my third and final year in residency, but we're gonna go out with a bang, I think, when we're talking about home care this year. So we've kind of progressively narrowed down our topic each year. And I think this is a very helpful one because it's kind of undersung and it's still a huge part of oral health. So hopefully we're going to be able to answer some questions on that. So my goals for this presentation are to review the relevant anatomy and some pathophysiology as well. I'm not going to subject you to a vet school lecture, but I earnestly believe that having a better idea of the why and the how will make all of the kind of strengths and limitations of our home dental care products make a lot more sense, so that our expectations are in accordance with our actions. That helps avoid disappointment on everyone's side. And then, of course, we're going to contextualize home care within overall oral health care because it is a part of the puzzle, but it is certainly not the entirety of that. So to that end, we're going to actually stole some slides from my presentation last year. So starting a little bit broadly, talking about dental disease, how prevalent it is and how it's perceived by both practitioners and clients. And we're going to get to the anatomy and in health and disease. We're going to talk a bit about the Veterinary Oral Health Council and how that's very helpful just to kind of as a starting point on your home care journey. And then finally, we're going to talk about some of the most common products and activities that we can do at home to improve our pet's oral health. Again, I can't help myself, so I'm going to talk about professional dental care a little bit because we would be remiss if we didn't remind everyone that that's a part of the picture as well. And finally, going to have some time for questions at the end. So in terms of prevalence, in veterinary medicine, it's always a little bit of a struggle because globally, we are always a little bit hamstrung in that we don't have the rich body of high quality literature that they have on the human side of things. It's harder to fund veterinary studies. So we're always a little less informed, unfortunately, than on the human side of things. But we do have a few larger epidemiologic studies that we can at least conclude from them that dental disease is very important and it's not something that we can overlook. So Banfield is one of the large chains of primary care veterinary clinics, and they periodically put out an annual report kind of looking at their large patient population and what things are prevalent there. And regularly, dental disease, no matter how you define it, is literally the most common disease in our dogs and cats, which I think a lot of clients don't know. Some veterinary personnel might not even know that, but in a this is a large study for the vet side of things. So 2.5 million dogs, over 3/4 of them had evidence of dental disease. Cats, many fewer cats, unfortunately. Cats are always kind of getting short shrift in the veterinary profession. There are more cats in households in the United States than there are dogs, but they're much less frequently presented for veterinary care, which is quite unfortunate. But those that were lucky enough to be prevented for care, again, almost 70% of them had signs of dental disease. There's an earlier study, still with large numbers, where even if they narrowed it down to dental calculus and gingivitis, which we'll talk about, those are very germane to our conversation today. Even if we narrow dental disease down further, our definition of it, it's still the most prevalent finding on unconscious physical examination. And these are examinations just at your family veterinarian, annual wellness even. These are just physical exam findings that these veterinarians were noting. And of over 30,000 dogs, 40% had these signs on physical exam. Unfortunately, again, half as many cats, but nearly similar percentage. So no matter how we define dental disease, even if it's a narrow definition of periodontal disease, it's still the most prevalent disease in all of veterinary medicine. So it's worthy of our attention. And with both of these studies, again, conscious animals just in the exam room with owner and pet and veterinarian. With dental disease in particular, and you can see this American Veterinary Medical Association, they have this nice infographic sort of for Pet Dental Health Month. It's a tooth-shaped iceberg because dentistry is always the tip of the iceberg when we're in the exam room and I'm looking at your pet and having a conversation with you, because the majority of the tooth is under the gum line. So we have to assume that what I'm seeing is just a preview of what's there. It may be much worse, unfortunately, compared to what we can see above the gum line. But still, even with this conservative estimate, even if with this underestimation, really still the most common disease in veterinary medicine. It's a very interesting survey. It's actually in Sweden, so we're, you'd be conservative with your extrapolations because it is a different culture. But let's be honest, Scandinavia is usually more progressive than the US in all things health. So I would assume that could also translate to veterinary health. But so very large number, over almost 60,000 dog owners in Sweden, over 1,000 veterinarians and over 600 nurses, veterinary nurses. The degree to which tooth brushing was thought to be important was quite low in owners, fewer than a third, kind of low in veterinarians, to be honest, only about 2/3, but then the nurses are carrying the weight as usual and at 80%, realizing that it is important. In their survey, about 2/3 of owners said they would consider brushing, but fewer than 4% actually report doing it. And from my yesteryears in psychology, whenever you have a self-report like this, whenever a client is volunteering information about themselves, you have to assume they're kind of overestimating a little bit to make themselves look a little bit better. Unfortunately, there's a bias there. So 3.7% is still probably an overestimate. Troublingly, so indicative of a knowledge gap, and on the client side of things, again, about 2/3 felt that diet was more important than brushing, and about half thought that dental chews were more important than brushing. And we'll get into the nitty-gritty of why that's not the case. And finally, startlingly, indicative of a huge communication gap is that over about 90% of veterinary personnel report recommending toothbrushing, and only 40% of owners heard it. So either, it wasn't phrased in a productive way, or, clients just get overwhelmed with, if you go in for your annual, it's flea, tick, heartworm, et cetera, et cetera, et cetera. It's hard to remember everything. So if you're not spoiled like me, or all I deal with is teeth, then it looks like fewer than half of the clients, unfortunately, recall being advised to brush teeth. So why is brushing important? Why is home care important? The anatomy that we're focusing in on, so last year's lecture, dental disease, we kind of lumped in trauma to the tooth as well as to the supporting structures and periodontal disease. We're winnowing it down this year to just periodontal disease. So what does that even mean? So perio, around, dont meaning tooth. So the periodontium is the collection of tissues that attach the tooth to its bony socket. So in the image on the left, that's actually a little cat's right mandibular canine tooth. And you can see kind of at the coronal extent, so the crown of the tooth, we have the hard tissues like the enamel. Below that, we have the dentin. But when we go below the gum line, so if you look at the image on the right, which is a tooth in cross section, you can see the white enamel. But when we go below the gum line, so the gingiva, so the gums, the gingiva attached to the tooth at the cemento-enamel junction. And then below, we don't have enamel anymore. We have a different hard substance called cementum. And then between the cementum, which is a part of the tooth root, the most superficial layer, the periodontal ligament, so connective tissue, runs between the cementum and the alveolar bone, so the socket. So that, the periodontium, is what keeps the tooth in the socket and provides a little bit of kind of shock absorption for all of the wear and tear that we put our teeth and our pets' teeth through. So what is periodontal disease? Well, as in people, it's a progressive loss of that attachment between the tooth and its tissues. So I want you to burn this image in your head. Sorry, that's a little aggressive, but looking at that gingival sulcus there, so the kind of cup of gingiva that hug the tooth, and then the kind of potential space between the enamel and the gingiva there. So this gingival sulcus, in health, there is some depth there. It can be up to 3 millimeters in some dogs, usually only like a 0.5 millimeter, if anything, probable in cats. But there is some, not pocket we usually refer to as pathology, but the sulcus is normal anatomy. When we have progressive disease, we get a periodontal pocket. So everything just goes down from that sulcus through the periodontal ligament, and the disease just erodes, and we have progressive attachment loss. It's not, it is, we'll touch on it, but it's surprisingly still poorly understood, even in people, even though we've been thinking about it and studying it for over 300 years now. We still have a lot to learn about it, but essentially it's progressive loss of the attachment between the tooth and those healthy tissues. In terms of pathogenesis, so in terms of how this process happens, we have to accept the fact that our mouths are dirty, unfortunately. There's, the oral microbiome, there are millions and billions of bacteria even within a healthy mouth. So there is some, normal resident bacterial population even within a healthy mouth, but they start to set up shop in that sulcus. And then there's a kind of complex interplay between those bacteria and the body that has that progressive attachment loss, which you can see on the right half of the tooth in that image. And the problem with periodontal disease is that it's not curable. It's always there. It's progressive if we don't actively try and address it. So that's why it is not considered something that we can, one and done. Just because your pet has come and seen me and had an anesthetized evaluation and we got out all of the bad teeth doesn't mean we're good. Unfortunately, it's always there. Those bacteria are always there. And even within seconds after professional ultrasonic cleaning with me, glycoproteins, so molecules within the saliva, start to form a dental pellicle on the surface of the tooth. So kind of a thin kind of gel almost immediately sets up shop. So it's a losing battle. It's always going to be there because of the nature of the oral cavity. Within hours, again, within hours after you walking out of your dentist's office, that pellicle becomes colonized with the bacteria that are always in your mouth. And then we have plaque, which is a biofilm. Burn that word into your brain. We're going to talk about it in detail shortly. But so this pellicle becomes colonized by the bacteria that are always there, becomes a biofilm within hours after seeing your dentist, and same with our pets as well. Within 48 to 72 hours, that biofilm starts to mineralize. So within the saliva in health, there are salts and calcium ions and things that will precipitate out of the saliva and start to mineralize in the plaque. When that happens, we get a progression from plaque to calculus or tartar. So calculus is mineralized. It's essentially like a rock. So that change happens within hours, and then it's clinically detectable. So I can start to see it and feel it in 48 to 72 hours. Concurrently, so alongside those processes, if we're not doing our due diligence and kind of beating back periodontal disease, we get gingivitis within 24 to 48 hours. So the gingiva, the gum line, starts to become inflamed because of all of that bacterial culture that's starting to appear there. That's reversible. So if we're doing our home care, if we're doing our professional care, once we get rid of all the calculus and biofilm, then the gingivitis can recede. Recede's a bad word because of recession, but it can go away, which is great. So we can get some gains there. But if we are not fighting the good fight against periodontal disease, if we have attachment loss, if we've gotten down into that periodontal ligament, we can't get those back. So that's irreversible, unfortunately. So it behooves us to stay on top of this disease process. What are biofilms? So biofilms are terrifying if you think about them too much, but they are ubiquitous. They are very much a part of nature, but we have to know and acknowledge that nature can sometimes be scary and not have our best interests at heart. But apparently biofilms they've been around for billions of years. Greater than 99% of all bacteria on the planet live in some form of biofilm. And what a biofilm is like plaque. It's this community, slime community, unfortunately, of an organic matrix and lipids and cellular debris and metabolic byproducts from the bacteria. And they start to create this whole little universe for themselves with things like channels for fluid and oxygen exchange, nutrients, waste movement. It becomes eerily to resemble like a dedicated tissue in a multicellular organism. So we have things like lungs, the heart, the kidneys, the bacteria form a community and start to have higher level functions that benefit that community. This is medically relevant, again, plaque biofilm. So I care about it because it's driving this very common periodontal disease. But other things like IV catheters, urinary catheters, surgical implants, prostheses, even living tissues, if these things become colonized by biofilms, not plaque biofilm, but other biofilms, then we're in trouble because these biofilms are very tenacious and they provide a lot of advantages to the bacterial community within them. So they help protect against desiccation. They help keep immune cells out. So our white blood cells that might otherwise want to get at these bacteria can't because the bacteria have made this little slime fort, unfortunately, to stop them. Similarly, these cannot be medically managed. So antimicrobial drugs have a great difficulty penetrating biofilms. And the bacteria, once they go from there in that image on the leftmost pane, and this is actually in the mouth. So this is a plaque biofilm image. You can see tooth enamel, pellicle, and then you can see those pink colonies starting on top of the pellicle. Free-floating bacteria are called planktonic, so it's their planktonic form, like plankton in the ocean, I guess. And once they settle into a biofilm, they actually start to change. They express different genes. They can share with each other. So if they have virulence factors or things that help them resist antibiotics, for instance, they share those with each other, and bad things happen from a medical perspective. It's great for the bacteria, but bad for us. And so they're, physically resistant, they become more genetically resistant, and it's just harder to treat the sulcus, the gingival sulcus in general from a medical perspective. The same planktonic bacteria, if we're trying to treat it with, say, an antibiotic in the sulcus, we need a 250 to 1,000 times higher concentration of the drug compared to the free-floating bacteria, same species. So it's very, very difficult, aka impossible, to just treat these biofilms with antibiotics, unfortunately. So they do require physical disruption to treat. So if your dog maybe had a TPLO, so if it had stifle surgery, knee surgery at the AMC, they put a metal implant in there, but one of the risks of that is that the implant becomes infected, and then you can't medically manage that. They have to do an explant, so they have to remove the implant. So similar with the plaque biofilm, we cannot medically manage it. We have to physically disrupt it and remove it. Things that make it worse. So individual genetics and host response. So two animals, two people that are otherwise quite similar may have dramatically different reactions to their own plaque bacteria. So perhaps only a smidge of biofilm is enough to set up a huge inflammatory reaction in one organism, whereas another might have gobs and gobs of biofilm and the body might not be terribly bothered by it. So there is some idiosyncrasy in the host response and the relationship to the biofilm that can make disease much, much worse. Small breed dogs, New Yorkers, looking at all of you, your Yorkies, your Maltese, your Dachshunds, your Cavies, all of those dogs, when we made their skulls smaller and cuter, unfortunately, their teeth did not kind of follow suit. So small breed dogs have a much more unfavorable tooth to jaw ratio relative to something like a Labrador or a Shepherd that's more phenotypically wolf-like. So their teeth are going to be generally more crowded, and crowding leads to plaque retention. Certain breeds, so even larger like sighthounds, for some reason they can get just really bad periodontal disease. Certain breeds of cats, Somalis, Abyssinians, sometimes they just seem to have a genetic predisposition to more exaggerated periodontal disease. Persistent deciduous teeth, so that image, if you'll notice in the upper jaw, there's the canine tooth, and then there's the deciduous or baby canine tooth, which is very much overstaying its welcome. So unfortunately, it's not too uncommon, especially in those small breed dogs, to hold on to those deciduous teeth. And again, those deciduous teeth crowding the adult teeth, plaque retentive, perpetuates periodontal disease. Poor systemic health, advanced age, those things are globally going to be hand in hand with worse periodontal disease as well. So why do we care? Tooth loss, that's a common concern. If your dog's teeth move like piano keys, or you start finding teeth around the house, or there's a little bit of blood in the water bowl or the food bowl, that is because once we've lost so much of the attachment from periodontal disease, then the teeth can exfoliate spontaneously. More concerning are things like facial abscessation. So in dogs and cats, some of the, more so in dogs, but the premolars and molars in the upper jaw, those tooth roots are right under the eyeballs. So sometimes if there's significant disease around a tooth root, you'll get a nice ruptured fistulous draining tract out through the cheek. It looks horrid, but it can actually be from dental disease. Similarly, in our dachshunds especially, there is a very thin wall of bone between the upper canine teeth and the nasal cavity. If periodontal disease erodes through that bone, then we have a nice big hole between the mouth and the nose, and that is awful. Food stuff will just get stuffed into the nose, things from the nose will come into the mouth. It's disgusting. So that's another thing that we need to be concerned about. And then perhaps most dramatically, thankfully not as commonly, but I've seen a number of cases in residency where this is a tridimensional reconstruction on the right of little Chihuahua who had a CT of his head. Unfortunately, I think this Chihuahua jumped from its owner's arms and landed on his periodontal disease. So this little Chihuahua has a bilateral mandibular fracture because the bone was already so weakened from periodontal disease, and because those teeth are disproportionately large in the lower jaw relative to a shepherd, what have you. In people, we have, again, much better documented evidence of systemic effect as well on systemic health and periodontal health. So there's a bidirectional relationship. In people, they've documented neurovascular disease, so things like vascular events, cardiac disease. So they have cultured in atherosclerotic plaques, coronary artery disease in people, which thankfully we don't see really in dogs and cats all that much. They've found plaque bacteria in the plaques in the vasculature, which is very gross. And low birth weight, premature birth, those things are associated with poor periodontal health. And actually poor periodontal health antagonizes diabetic control. So it's harder to regulate diabetes if the mouth is a mess. We don't have, again, great experimental demonstration of these things happening in dogs and cats, but a mammal's a mammal is a mammal at the end of the day. So it would be, I think, very short-sighted for us to assume that cats and dogs are free of these systemic consequences just because they're not humans. So what do we do about it? Fortunately, there are things you can do about it. So we can empower ourselves to help fight this battle against periodontal disease. And to help, there's the Veterinary Oral Health Council. So the VOHC was established in the 90s, late 90s, in response to the commercial pet trade being kind of flooded with products that were that had unsubstantiated health claims for oral health. The members of this council are boarded dentists, so veterinary dentists, so they're diplomates of the American Veterinary Dental College. It's not a regulatory body. It doesn't perform research in its own right, but they review research that is voluntarily submitted by manufacturers of products that want to be able to make this claim. And so if a product has this seal, then the hope is that family veterinarians and family members, human family members, at least have some faith that a product with that seal has at least a modicum of efficacy. So the seal indicates some scientific support for the claims that the product is making. There are two designations of the approval. So there's plaque control and then tartar or calculus control. There are standard research protocols that the VOHC has established. And then if the manufacturer follows these guidelines and submits the data, the VOHC will review it. And if they find it sufficient, then they will stamp the product. Great. They literally on the website have spreadsheets of approved dog products, approved cat products that you can download. I would strongly recommend you do that and use it as a shopping list. So they have categories that we'll talk about, but they have right there a spreadsheet for you of the approved products. So if you are inspired, hopefully after I've talked tonight, then get that spreadsheet, use it as a shopping list, see what works for you and your pet. Important caveat, the VOHC acknowledges that these products in and of themselves, none of them are going to cure periodontal disease. None of them are going to be sufficient to obviate the need for professional cleaning. And they are best utilized as part of a multimodal approach. So synergistically allowing the benefits of all these products and activities to act together to improve oral health. So if your friend told you, I've never been to the dentist, I brush my teeth, proudly exclaiming that, I would hope you would view that person with alarm and concern and suspicion rather than admiration. You brush your teeth twice a day, every day. Ideally, you floss every day too, and we're still supposed to go to the dentist regularly. So none of the things I'm telling you about today are going to keep your pet away from me or your vet. And part of that, what we need to, I think, specify is that when we're talking about home care, we should really be thinking about plaque biofilm removal, not calculus removal. So once we've gotten to the point where the plaque is mineralized and we're starting to get these kind of stalactite, stalagmite depositions on the teeth, it's game over. You need professional help. You can't deal with this at home. Don't try to, but keep that in mind. There are limitations. We can do a lot to help, but once we've gone beyond biofilm to calculus, it's time for the village to help this mouth out. You can't do it on your own. So what can we do at home? We can actually do a lot. And I'm going to start with talking about toothbrushing, even though that is a hard sell in veterinary dentistry, but it truly is, as in ourselves, that's why you've been doing it your entire life. It's truly the best thing that we can do. And we call it an active form of care because we are actively working with our pet to mechanically remove that plaque biofilm. So the image on the right is a disturbingly close-up view of the white surface is the enamel of a tooth. The tan grossness is the biofilm, and then those kind of vaguely blue-green structures are bristles. So that's a toothbrush getting rid of that biofilm. So mechanically removing the biofilm that is constantly trying to set up shop. That's the single best thing we can do. Fortunately, it's very cheap. Upfront cost is very cheap, just need a toothbrush essentially. And then really doing it is free other than your time. So it's one of the most cost-effective things we can do. And it's also one of the most sort of medically effective things we can do, which works out. In terms of brush choice, I usually recommend a human toothbrush, actually, the softest bristles that you can find. Some of the veterinary toothbrushes are actually a little bit stiff bristled for comfort. So, going to the drugstore, getting a children's toothbrush with a cartoon character on it, great. Soft as you can, just so that it doesn't traumatize the gingiva and make it an uncomfortable experience for your pet. That's not going to help us institute this practice. Things like using gauze sponges or washcloths to kind of wipe away the plaque on the teeth. It's probably better than nothing, but again, think back to that sulcus, think back to the biofilm. The gauze and the washcloth is not going to get into that gingival sulcus the way that bristles are going to. There's a reason. Again, we use toothbrushes. They're very familiar with it to us, and that's because those bristles are able to get into the gingival sulcus in a way that gauze cannot. Thicker bristles, again, may be more painful, maybe more damaging. We don't need to give our pets any reason to not want to have their teeth brushed. So get as soft of a brush as you can. I learned in residency that dentifrice is the sort of overarching term for things like toothpastes, powders, gels, liquid agents, anything that you apply to a toothbrush to help increase its efficacy. On the human side of things, it will have things like abrasives, humectants, fluoride. We want to make sure that we're using a veterinary toothpaste because we don't want our pets to be ingesting fluoride. We can't tell them not to swallow the toothpaste that we're using, so don't use a human toothpaste. But it's actually less essential than in the human side of things. The fluoride in human toothpaste is really to treat dental caries or cavities, and caries in veterinary species are actually vanishingly rare, at least in dogs and cats. So like fewer than 5% of dogs will have true carious lesions in their lifetime. So we don't need fluoride. It's not what we're about in veterinary dentistry. So just get a veterinary toothpaste if you feel inclined. Really, I would view it as a training aid. So a lot of them have nice flavors like chicken, seafood, malt. I would say nice to pets, not to us, but get a nice flavor that is in and of itself a treat. Some of them have other additives, enzymes, mineral chelators that we'll talk about from a mechanistic perspective, but you don't need those. It's really all about the toothbrush. So if you can't be bothered to spend another penny, warm water works too. Just a wet toothbrush is fine. It's much less of a central component on the veterinary side of things. In terms of technique, so I have some clips for you, and we're going to start just kind of discussing what's going on, and then we'll play the clip. But essentially, the technique, it's even a little bit more modest than what we try and do for ourselves. Similar to ourselves, we're aiming those bristles at a 45-degree angle, so we're getting into that gingival sulcus. Remember that important anatomy. So we're trying to get in there between the gingiva and the tooth, and really about 30 seconds per side. And we're especially in dogs and cats, we can really focus on just the buccal or the cheek side of all of the teeth. You don't have to open the mouth. That's a much harder sell from a behavioral perspective for most patients. So even just getting the outside surfaces of teeth will be doing a world of good. Dogs and cats, their occlusion is different from ours. So we have what is called isognathic jaws. So our upper and lower jaws kind of meet together and we do a lot more chewing. Dogs and cats, they're anisognathic. So their upper jaw is a little bit wider than their lower jaw. So they actually do some degree of kind of scissor bite that self-cleans. So the inside surfaces of their teeth are not usually where they collect dental deposits. So you don't have to open your pet's mouth. You can actually hold their mouth closed and just get in the cheek and get the cheek side of their teeth. So here's a snippet from Dr. Carmichael, who worked here for many, many years in our dentistry service. And it's I believe this is a staff pet, but it doesn't have to be elegant, but he's just working to get the outside surfaces. The dog is lapping up the toothpaste, you can see. This is a veterinary toothbrush, but again, just run-of-the-mill nylon bristles, as soft as you can get. In terms of implementing this, starting at a younger age is great. So if you get a puppy, if you get a kitten, you should be handling their feet so that nail trims aren't a bloody nightmare when they go to the vet. You should also be handling their mouth. So really just desensitizing them to you handling their mouth, you passing your finger under their cheek will do a lot, not only to help them accept toothbrushing, but also to help you keep a better eye on what's going on in your pet's mouth, because a lot of clients will show up in our exam rooms and have no idea the degree of the disease that's there, even just dental disease, but also things like oral tumors or dental fractures, much less common things than periodontal disease. But if you can catch those things earlier, often outcome is better. So if you can create a relationship with your pet where they feel safe, you looking in their mouth, and you are safe as well, please don't lose any fingers, then it is better for your pet's overall health as well. Positive reinforcement is huge in this endeavor. So again, if you can find a delicious toothpaste, that might make or break your efforts. And go slow. So it's as much a behavioral intervention as a dental one. So if you think about things like just teaching a dog to sit, shake hands, you're kind of chaining behaviors together. You're breaking them down into small, more simple, straightforward behaviors. You're positively reinforcing them so that they find it fun and rewarding. Think of it more as just training globally. We're just training to do something that is the most effective thing we can do at home for our pets' oral health care. So this, I promised Michelle that I would get a video of cat toothbrushing. And I sent her these clips with some trepidation because it looks a little bit chaotic. And before I play it for you, just so you don't scream abuse, my cat, I have trained, Finnegan is his name, to actually give paw. So whenever he wants something now, he just kind of slaps me. And there is a point in this video where it looks like we're having a slap fight. That's not what's happening. We're not hurting each other. We love each other. But anyway, here's the video that Michelle edited, so it looks a little bit more respectable. But we're just introducing toothpaste. So Finnegan is unhealthfully obsessed with the flavor of this toothpaste. He will do horrible things for it. He would probably kill me for it. But it's great because it allowed me to really build up to the toothbrushing. He's really into it. It's one of his favorite things. So again, we're just chaining. We've introduced the toothpaste. We've swiped it under the cheek. So just do a whole week for swiping under the cheek. Then introduce the toothbrush. Great, this delicious thing with no negative consequences is on the toothbrush. Okay, the toothbrush is a little bit more in my mouth. It's still delicious, not that big of a deal. And then finally, I'm not choking him, he's having a good time. Finally, we can approximate that toothbrushing. That will be the most helpful thing we can do at home. So just break it up, take it as slowly as possible so that it's just enrichment really for you and your pet. This is a great way to spend time with your cat, really. Cats, they, again, not brought to the vet as often as they should be. I feel like cats historically are kind of ornaments sometimes around the house, but you can really interact with your cat in a lot of meaningful ways that will benefit you both, including toothbrushing. He had a fun story that I promised I would tell. This is actually the second tube of toothpaste that we had to do for this filming because Finn stole the first tube when I wasn't looking, and by the time I found it, it was punctured full of little tooth marks and inoculated with all the little bacteria. So if they really like the toothpaste, keep an eye on it. But anyway, it can be an exceptionally helpful aid when you're training. So data, I like to be data driven in my conversations with clients. Again, our data is never going to be as great on the human side of things, but we have enough to back up the things that I'm telling you. I'm not just pulling things out of thin air. So there's a semi-recent study from 2015 where we actually look at toothbrushing in dogs of varying frequency, because a lot of times clients will come and say, yeah, I brush the teeth. I'm like, great, that's amazing. Once a month. I'm like, oh, so frequency is important because what we know already about the pathogenesis of periodontal disease. If we're doing it once a month, we are running our toothbrush over calculus, and that helps no one. So this study, relatively short term, but still within the study period, they had different groups of dogs, a control group where there was no brushing, and then groups where the teeth were either brushed every other week, weekly, every other day, or daily. And the kind of curve on the left, you can see that when we score the plaque and the calculus, there's a relationship between the just number of times that the teeth were brushed. So as we go to the right on that graph, more times the teeth are brushed, the lower and lower and lower are the values that we have for plaque and calculus. Makes sense. The box on the right, there are a lot of numbers there, I'm sorry, but I can pluck some out for you. So essentially for plaque, that biofilm, if we brush daily, there's about a 37% reduction relative to the controls that are not brushed. If we brush every other day, there's about a 25% reduction. Both of those values are statistically significant relative to the control. If we only brush weekly, we get less than 10% reduction, and it's no longer statistically significant. So you might as well not be brushing if we're not doing it at least every other day from a plaque perspective. When we talk about calculus, so keeping that plaque from mineralizing to calculus, if we brush daily, there's a significant 80% reduction in calculus, which is great. If we do it every other day, there's a 62% reduction. If we only do it weekly, there's a plummeting, but still significant reduction at about 23%. And any less frequency than that, we're not doing any good at all. For gingivitis, which again is kind of the first stage of periodontal disease, that reversible inflammation that precedes attachment loss, if we brush daily, there's a 61% reduction compared to not brushing. If we brush every other day, there's a 33% reduction. Both of those are significant. If we only brush weekly, we're actually not helping gingivitis at all. So frequency does matter. You should be aiming for at least every other day if it's feasible. And I think if we approach it as positively as possible, I think that is achievable for many patients. It might not be achievable for everyone though. So no matter what, sometimes it's going to be a no-go, and all is not lost if that is the case. If toothbrushing is completely off the table, then we start kind of going down in descending order of helpfulness, and we get to consumable products like dental chews and dental diets. So these are aimed to mechanically remove plaque biofilm as well, but they're passive forms. So you're not getting in there scrubbing the tooth. You're just offering them something that will try to approximate toothbrushing, but again, is not going to get into that sulcus like a nylon bristle will. And we know this because even though both of those things can be helpful, there's a study on the right showing that daily toothbrushing was 3 times more effective than a daily dental chew or a daily dental diet. So chews and diets were helpful, but 3 times more effective was the toothbrushing. The dental chews and diet in that study were about equivalently helpful. So they're kind of the same thing, but if we put them together, maybe again, we get a synergistic effect. So it's not like we can only choose one thing from the VOHC list. We can do as many things as we want, especially if your pet is very, very prone to periodontal disease and you tell me, Doc, I don't want to lose a tooth in my Yorkie's mouth ever. I'm going to tell you that's not realistic, but we can do our best. And here's how. For dental chews, there are some of them that, again, we'll get to these more chemical aspects of things, but there are some that have enzymes and chelators and other agents kind of impregnated into them. They're not going to make or break it, but again, let's be as multifaceted as we can, but it's really about the mechanical action. If you, especially if you choose from the VOHC list, the chews are sized to patient size. So do get the right size. Don't give a Great Dane a Yorkie-sized dental chew, because then you do risk serious consequences like esophageal foreign body. That's horrifying. We'd want to avoid that if possible. If your pet is already a little bit over-conditioned, which most pets are, unfortunately, we do need to account for the caloric intake of the chews. So we don't want to net positive on the number of calories that your dog or cat is consuming. So work with your family veterinarian to kind of subtract the caloric value of the chews from the regular diet. Similarly, if your dog has a very sensitive stomach, some of these may not agree with them just from a run-of-the-mill GI perspective. There are a few options on the VOHC list, though, that are free of animal proteins, which are the most common kind of dietary allergen in dogs. So there are some that are plant-based that may be a little bit more tolerated in our sensitive stomach dogs. Dental diets. So we desperately want to believe that conventional just kibble diet is doing something. You know, the crunch must be better than a canned diet. The data that we have doesn't really support that, unfortunately. And if we think about it, it does kind of make sense because dogs and cats don't really chew all that much. They just kind of inhale their food, no matter the form of the food. And conventional diets, as soon as the tippy tip of the crown of a tooth breaks the kibble, it's going to shatter. Like, it's not going to make it all the way to gently brush the sulcus. So specifically formulated dental diets, their size, their pattern, their density, their fiber content are all designed to maximize the contact of the individual kibble with the tooth and have kind of a brushing effect. So they are intentionally planned to approximate that toothbrushing in a way that, unfortunately, conventional dry diets just don't. So maybe a dry diet is a little bit helpful, but it's not going to perform the way a specifically formulated dental diet will, unfortunately. There are things, there are barrier sealants. So there are two that I think are on the VOHC list. One is hydrophobic, one is hydrophilic. The hydrophobic one, initially the kind of high viscosity formulation would be applied by the veterinarian after we have professionally cleaned the teeth. And then there's a lower viscosity form that you can apply weekly at home. I kind of think if you're applying a barrier weekly at home, you could probably just brush the dog's teeth and be a little bit better off. But if the toothbrush in and of itself is literally the problem, then okay, maybe this product will work for you. The hydrophilic sealant, so the hydrophobic one is just kind of to make the teeth kind of like Teflon. So there's not Teflon in it, but just kind of keeping plaque and food stuff from adhering to the teeth. The hydrophilic sealant, apparently it's more to try and kind of occlude the sulcus. So it's applied into the sulcus and kind of just helps keep things out, but it is permeable to things like water and oxygen. This one, it would only be applied professionally after cleaning. There's not a home version. This one I have a little bit, I think both of these actually in my mind are really reserved for patients or clients for whom brushing is just a non-starter. The hydrophilic one specifically, the product claims six-month efficacy, but if you look at the VOHC study, the study was only 30 days. So I don't really believe that we get 6 months out of it. 30 days is better than nothing, but you know, if you don't get your pet's teeth cleaned again for another year, then that month isn't really going to make or break oral health. So I think there's a risk of a false sense of security with these products because of their limitations. But if you're very motivated and toothbrushing is not on the table, then it's certainly something to discuss with your veterinarian. Finally, there are everything else has been, except for prior to the barriers, has been more of a mechanical intervention. There are chemical ones, and these are kind of found in a number of different products and a number of different vehicles. So they are in some dental chews, they are in water additives, they are in gels, they are in wipes. So the administration of these agents is less important than what they do chemically. And I think that's important to help you, again, realize their limitations and what they're actually doing. There are chelators. So I've said that word a number of times. So chelator is something that binds. So hexametaphosphate is a mineral chelator that will sequester that salivary calcium to reduce the calcium's availability to precipitate, to turn that biofilm into calculus. So it helps to kind of slow deposition of calculus, which really just gives you or the other mechanical means a longer opportunity to remove that biofilm, but before it becomes a calculus deposit. Similarly, there are some enzyme systems like glucose oxidase and lactoperoxidase. In oxygen and water in saliva, they form a molecule called hypothiocyanate, which apparently is a naturally occurring molecule in the saliva that has antimicrobial agents. So we're just making more of what is already part of the saliva's natural defense against bacterial colonization. So some products will have those. Chlorhexidine, so that is it's an antiseptic, which is nice. It kind of physically destroys bacteria so they can't develop resistance to it, which is nice. It comes in a mouthwash, so an antiseptic rinse that I do prescribe fairly often. The problem is it tastes not good. So I have yet to meet a patient that enjoys this. So I think this is helpful for things like jaw fractures. I will send these home if we're flushing around splints, something that's going to be accumulating a lot of debris for a number of weeks. But I think the odds of your pet enjoying this being used as part of your routine daily is pretty low, but it is there. And I think there are actually some dental chews with chlorhexidine, so maybe that's more palatable and you still get an antimicrobial effect. Finally, there are some products that have, and I think someone mentioned already, kind of product ingredients lists. Yes, great. Like these are the things you should be looking for in those ingredient lists. If you see things that are zinc salts, those are antimicrobial in and of themselves, and they are also, they bind sulfur. So a lot of what drives halitosis as sulfur-containing compounds. And so things that have zinc salts in them will bind that sulfur and make mouths smell a little better. Is that going to get rid of the plaque biofilm? No, it is not. But if we want to do every little thing, then sure, let's add a product that has a zinc salt in it. Why not? Things that are unhelpful and actually quite dangerous, potentially, things that I am telling you not to pursue, and I regularly have people tell me that they do. So anesthesia-free or non-anesthetic dentistry or scaling. This is often when clients will come in and say, oh, my groomer scales the teeth once a month. Please stop it. Please don't do it. Please don't do it. Because after this lecture, we will know that chunking the calculus off of the supragingival crown will do nothing for subgingival disease. And it's actually unsafe for the operator and the patient. So you can't rationalize with your pets, unfortunately. I can't rationalize with my patients. That's why they're on a table anesthetized and not seated in a chair. So if you put sharp instruments for removing dental calculus in an awake patient's mouth, you are close to things like the brain and the eyeballs. So if your pet moves in the wrong way, then there's potential for significant injury and even just discomfort. So again, why should we subject our patients to pain when we don't have to? So this is often offered by groomers, unfortunately. I believe it's actually illegal in the state of California for groomers to perform this function because it is a medical intervention. Even disappointingly, even some members of the veterinary professional community will offer this service, but it's not backed by what we now know about the disease pathogenesis. And again, it's not safe. And I've had a number of cases during my residency where, yeah, above the gum line, things don't look that bad. And the client proudly says, yeah, the groomer has been taking care of that calculus for years. We get in there, we do a professional evaluation, and I took out 25 teeth. I'm sorry, but that's where we are. So if we're not treating the subgingival disease, we're not actually doing ourselves any favors. Similarly, social media, the mixed blessing of our lives. Bones, raw diets, you will be led to believe by your Facebook group potentially that these are the be all, the end all, these are the panacea for oral health. They are not. There's no data whatsoever to support that a raw diet or offering bones, whether they're raw or cooked, will improve oral health in dogs and cats. I know it's natural. So is rabies. Natural isn't good all the time. So don't give your dogs bones from a dental perspective. It actually risks dental fracture. We're not really talking about that in this lecture, but many, many patients come through with fractured teeth because of bones, antlers, hooves, all things that are too hard, even though they're perfectly natural. And just from a public health perspective, I'd be remiss if I didn't advise you as a veterinarian that raw diets increase your pet's likelihood of foodborne illness. It increases your likelihood of foodborne illness, whether from preparation of the raw diet or from your pet shedding the bacteria. So I know it's very popular. I know people have developed an almost spiritual attachment with the practice, but I will never advise it for patients. There's also a nutritional concern. So if you're feeding diets that aren't professionally nutritionally balanced, you can cause things like heart disease in your dog. So more power to you if you want to cook for your dog to begin with or create a diet. Just do it with veterinary assistance. It can be done if you want to make a home cooked meal, great. If you have the time and the dedication to do that, just do it with a medical professional's guidance so that we're not harming our pets unintentionally. And finally, I can't help myself. We're going to talk about professional care as well, because again, you brush your teeth, you still go to the dentist. Even if you adopt toothbrushing after tonight, your pet still needs to go to the dentist. Doesn't have to be with me, it can be with your family veterinarian if they have an adequate setup. But all pets at some point in their lifetime will need a comprehensive oral health assessment and treatment, or COHAT. It's not a very charming acronym, but that's what we use. It does require general anesthesia because we need things like full mouth dental x-rays, full mouth intraoral radiography, ultrasonic scaling, dental charting, probing with a periodontal probe, all of those things. And again, all of those things should be familiar to you from your time in your dentist chair. All of those things are equally important in diagnosing, staging, and treating dental disease under the largest umbrella in veterinary dentistry as well. Image on the left is a greyhound, large breed dog, not immune to periodontal disease. We cannot brush our way out of this situation. Once we have professionally evaluated the situation, so the middle image is actually a dental radiograph, and we can see that it's even much worse than we can see above the gingival margin. So it looks like maybe we've lost about 50% of the bone on the tooth if we're just staring at it on the wake exam. Once we take that x-ray, we can see the actual back root of that tooth is floating. It's floating in a cup of granulation tissue and maybe pus. So it's floating. We need radiographs, we need probing, we need charting to fully diagnose and stage dental disease. This needs to happen routinely within your pet's lifetime. The frequency with which will be somewhat, again, individual dependent, and it'll be a risk-benefit analysis with your veterinarian. But very prone species, very prone breeds like Yorkies, Maltese, very popular breeds in New York City. Some of them, if you really don't want to lose any teeth or you want to maintain their teeth for as much of their lifetime as possible, I may be recommending annual cohat. I may be recommending every 6 months. So it's always going to be a conversation with your veterinarian, but nothing that I've told you about home care today will obviate the need for this professional evaluation. So in summary, dental disease, no matter how we define it, is the most common disease in dogs and cats. It can negatively impact reasonably their systemic health and quality of life. Even if our pets aren't, a lot of times I'll have clients say, oh, my pet's still eating, I don't notice oral pain. Our pets are innately stoic. You know, cats are mesopredators. They're in the middle of the food chain. It doesn't behoove them from an instinctual perspective to show weakness or pain. And, you know, the whole they're still eating argument, well, if their choices are eat or die, they're going to eat. So oral pain, even if there's no overt sign whatsoever, doesn't mean that there's not disease, potentially significant disease below the gum line. Periodontal disease is chronic and progressive. It is incurable, but we have a fair number of things in our armamentarium, even in the home setting, that we can do to help delay its progression. Toothbrushing being the most effective of those things, but a multimodal approach. If any of these things have inspired you, then just go to that VOHC list and come up with a whole plan in combination with consultation with your veterinarian to maintain health at home. And again, you still have to bring them to have an anesthetized examination periodically, even if we have the best of home care. So again, resources, the VOHC, the dental college that boards veterinary dentists has a lot of nice client geared resources on their website, as does the American Veterinary Medical Association, as does the Usdan Institute. So Michelle and Kimberly do a wonderful job of maintaining a pet library on the AMC's website that reiterates a lot of these topics as well. So there are resources, do your homework. And now I would be happy to take questions. Thank you very much, everyone.
Okay, thank you. That was wonderful. We really appreciate all of your efforts, and the toothbrushing with your cat was amazing. Thank you. It is phenomenal. So thank you for that. Maybe if you want to unshare your screen so we can see you a little bigger. We have a lot of great questions coming in, so we'll get to as many as we can. So one question about brushing minimal teeth, brushing the gums if teeth have been pulled, and I know you say it's better to pull them if they're bad, but just how do you care for teeth, minimal teeth?
For sure. Most of the general principles still apply as long as there is a periodontium in the mouth, then it is available for colonization and disease. Things might actually get easier, especially in those crowded small mouths, once we have taken a few passes and thinned the herd, so to speak. So we have less crowding, have less disease. I don't think I explicitly said, actually important, if your pet has significant disease and is uncomfortable, wait until after we've cleaned house before you try to institute things like toothbrushing. If they're uncomfortable, it's going to make it not their favorite activity, and toothpaste may not be able to save you at that point. So start with a blank slate. If we've taken a bunch of teeth, even if there are only a handful left, even if just the canines are left, brushing and all the other products can still be quite helpful, and it may just be easier because you have less territory to cover. But as long as those structures exist until we've taken every last tooth, then everything we've discussed still applies.
Okay, you have some questions from pug owners and other flat-faced breeds, so caring for them.
Oh yeah. They similar, yes. So another good point. I don't think I specifically said, but small breeds and brachycephalic or short muzzled breeds, when we stunted their little noses, unfortunately, again, we generally have the same complement of teeth of the same disproportionate kind of surface area, and we shorten the snout, which not only crowds them more, but rotates them, and sometimes they just look like, you know, the childhood game jacks. You know, you just throw them on a pile on the ground. Sometimes that's what pug and Frenchie mouths look like. That just makes everything more plaque retentive and making them more prone to periodontal disease and things like oronasal fistulation. So yes, anything that unfortunately, anything we did to make them cuter made them a little bit more susceptible. So yes, brachycephalic breeds are also particularly susceptible.
Okay, but still need to brush, right? So,
Correct.
yeah, yeah.
Mm-hmm.
Okay. Yeah, I know there are many concerns about anesthesia, especially on cats or older pets.
Mm-hmm.
You could speak a little bit about that, or
Yes. You know, I desperately wish I didn't have to anesthetize all of my patients, because anesthesia is scary for me too. But we just, again, we have to contextualize it within a risk-benefit analysis. If I were to go under anesthesia right now, if you were to go under anesthesia right now, there is a very small but real risk that I might never wake up. So we just have to kind of accept that. But things like doing adequate pre-diagnostic screening, so full blood work, chest radiographs, echocardiograms, if we have heart murmurs and things like that, if we have any systemic health concerns, that things like cardiac disease, renal disease, that make anesthesia a little bit higher risk, that doesn't mean we can't proceed. Many of our patients are referred here specifically because the family veterinarian no longer feels comfortable managing that general anesthesia in that setting. So we're spoiled being at a referral hospital to have things like, you know, all of the, you know, full complement of anesthetic monitoring equipment that may not always be present in private practice. We have more drugs available to us, so we can use like cardiac sparing drugs that depress the heart less if we have pre-existing cardiac disease. So there are ways that we can still safely anesthetize patients that we've decided their oral health is causing them enough discomfort, affecting their health enough that we will still take the plunge and anesthetize them. So it's really a matter of just making sure that you have a conversation with your veterinarian, and that if you're not doing the anesthesia in a referral hospital, just making sure that it is an adequate setup in the primary care setting. And the dental college's kind of client-based website has actual questions that you should ask your vet about dentistry and their dental setup. So is their anesthesia monitored by a licensed veterinary nurse? Are the veterinarians the ones actually doing the oral surgery? Those things are all important. So those things will all increase safety of general anesthesia no matter the setting. But yes, there just gets to be a point where we have to bite the bullet, so to speak. The risk is real, but it is low. You know, it's kind of much smaller than 1% chance, but it is real. And as our anesthesiologist says, like, the percentage doesn't matter to you. If your pet passes, they will be 100% dead. So that will be heartbreaking no matter what, but we just have to go about it as safely as possible, check all those boxes, cross all of our T's, dot all of our I's, and make sure that it can be safely done. And even with significant systemic disease, it still can be. To that point, though, you know what makes general anesthesia a lot briefer and therefore safer? Home care. So
there you go.
If you want it to be a shorter anesthetic event, don't bring me your Yorkie who's 15 and has never had a dental, and then taking out 25 teeth is a lot longer of an anesthetic episode than just a cleaning. So home care can actually do a lot to reduce the time that I need to have the patient under anesthesia to do the work that I need to do. So it does benefit you and your pet to stay on top of things at home. Repeated episodes of anesthesia throughout a pet's lifetime, if you heard me say, you know, maybe your pet will need an anesthetized examination annually and spit out your water. Repeated episodes don't cause cumulative risk. So it's not like because your pet has been anesthetized 10 times in their lifetime that they're more likely to expire under anesthesia on the 11th time. It's about duration of anesthesia. So there comes a point where every minute under anesthesia increases risk of complication. So again, help me keep it short, and then it is all safer.
Okay, well, wonderful. And I know this is a lot of information for everyone. We will send out the link tomorrow to watch again, as well as links to look up some of this information that is mentioned. We'll send that all out tomorrow. This is a cute question and a good one. Can I use the same toothbrush for multiple dogs in the household, or would it be best to have a separate one? And a follow-up to that is, how do you clean your pet's toothbrush?
Great questions. I think just for kind of simplicity's sake, I would probably just do one toothbrush per pet. But honestly, if you just clean it really well with soap and water between uses, which yes, that would be my answer to the second question, is soap and water, let dry. I think our pets' toothbrushes are probably cleaner than our own, to be honest. So yes, just soap and water is enough to clean. I don't think it would be an egregious sin if you use the same one, as long as you clean it appropriately. But there, you know, the financial burden is low in acquiring the toothbrush, so no reason not to get everyone their own cartoon character.
If that's cute. Yeah. Okay, are some chews like bully sticks adding especially bad bacteria that makes it worse than the benefit of mechanical removal in addition to brushing?
Good question. So I limited the products we discussed to VOHC products, just for simplicity's sake. When we talk about things that are kind of like chew toys, when in the literature we call them chewing aids. So they're not specifically designed, but they, again, yes, approximate that mechanical removal. I wouldn't say I worry about things like bully sticks and rawhides introducing bacteria. I think they can be great to help with the mechanical removal. It's just a matter of choosing something that's not also going to break the teeth. So bully sticks are usually okay because they soften. Rawhide is usually okay because it softens. Dense rubber, rope toys, plush toys, all of those things are good. Hooves, even the very hard nylon bones, those could be too hard and will break teeth. So we say kind of the rule of thumbnail. So if you can't indent the toy or the chewing aid with your thumbnail, it's probably too hard. If someone hit you in the knee with it and it would hurt, probably too hard. If you wouldn't throw it at your car's paint job, probably too hard. So that's kind of the cutoff, really. But otherwise, no, I wouldn't worry about so much as bacterial inoculation. It's just make sure that we're not doing more harm than good.
And I know someone had asked this, but it's always good to bring up is tennis balls, which I know.
Yes, thank you. Tennis balls would seem innocuous, and they certainly are very fascinating for a number of dogs, but the felting on them, when chewed upon, acts like sandpaper and will wear teeth down to the gingival margin, will expose pulp, will cause pain, will require extraction or root canal. So no felted balls, but if you can find, an otherwise acceptable ball of that size, great. Just no felt on the surface, because unfortunately it does remarkably, you wouldn't think, but I have seen teeth worn all the way down from them.
Yeah, definitely. We have some pictures that we've posted on social media, which are really just upsetting. What about the toys? If you go to any pet store, as you know, there's just aisles and aisles. It's amazing. But just these like toys with the nubs on them, do they do anything? And they're kind of advertising like cleans teeth. Yeah.
I've seen, yes, I've seen there's kind of a generation now of products. I think as long as it's soft enough, then it does no harm, but I wouldn't, unless it has that VOHC seal, I don't think there's anything to substantiate any claims beyond that. So if it's nubbly and rubbery, great. I wouldn't say it's any better than the next rubber toy. So as long as it's otherwise appropriate as a chewing aid, great. But if it's more expensive because it claims to do something that's not supported, then find something more affordable.
Okay. I know you mentioned wipes and that and I know someone else had mentioned a question earlier about gauze. So the mechanical part, does that do anything, or?
It probably does something. And I know there are products that are kind of pads that are meant to be wiped along the gingival margin, but they're not going to get in there like a nylon bristle. If they're impregnated with some enzyme or chelator, great. It's probably better than nothing. And it may, if you really can't introduce toothbrushing, then excellent, put it in your routine. But again, just mechanistically, we shouldn't expect it to be as efficacious as a toothbrush.
Okay, great. And then we have, I think someone maybe missed this earlier about human toothpaste. Yeah. And just, is there any, not any specific toothpaste, you were just saying one that tastes good to your pet, right? But that it's really more the actual brushing. Just
correct.
To reiterate,
yeah, toothpaste is not required on the veterinary side of things. Just use it if your pet loves it, is what I would say.
Great. Let's see. Oh, how often to get the professional cleaning?
That's going to be very patient dependent. The dental college kind of recommends that all pets by age 2 should have an anesthetized examination. And that's not so much because we expect them to have significant periodontal disease at that point, although some will. Those micro Maltese that are showing up now that are not even a kilogram. For some patients, it's never too early to get those dental radiographs. But even if a mouth is ostensibly normal, it still is helpful just to get a baseline. And if there are things like missing teeth or congenitally abnormal roots, like things that we aren't going to see in conscious examination, it's good to find out about those things sooner rather than later. If teeth are missing, they might not be missing, they might be impacted or unerupted. And in dogs, that can actually lead to cyst formation, which can destroy parts of the jaw. So especially if even your young animal is missing teeth, you should screen just to make sure they're truly absent. So it's kind of never too early for a baseline. After that, it's really kind of very patient specific. So I would say what I recommend to clients is get a baseline, come back in a year, then we can kind of track progress. Is everything still looking great after a year? Is your dog a Labrador retriever? Are you brushing the teeth? Great, maybe we can space it out. Do you have a Yorkie? Are you telling me your Yorkie should go to its grave with its full set of teeth? You're going to be coming in every year. So it's about the patient, it's about client goals, it's about what we can do for home care. But it is always going to be a conversation with your veterinarian in light of your unique and special pet.
Okay, great. Just a few more. I know it's getting a little late, but I have a 2-year-old lab that at 1 years of age developed brown and beige stains on her rear molars. Vet says it's just stain and to brush. I've been brushing but it's only slightly better. Is there anything else to do? Yeah.
So that's a good question. We do see staining, but I want to believe it's not actually as common as we think. What I think we're often seeing, if there's kind of a brown, potentially a quite deep brown coloration on the surface of the crowns of your usually dog's teeth, what that actually can be is a form of dentin called tertiary dentin or reparative dentin. So that can actually be a reaction to gradual abrasive trauma. So if your lab is a heavy chewer, if they're chewing on a lot of things in the back of the mouth, then the teeth, if the insult is slow enough and mild enough, there is some reparative potential in teeth. So they can kind of lay down this hard tissue to keep from the pulp from being exposed with that chronic trauma. Unfortunately, from a cosmetic perspective, that dentin, that hard tissue, is often much darker than the enamel of the tooth. So I would suspect that might be what you're seeing, and there's nothing you can do about it. You should congratulate the tooth for protecting itself. And we're blissfully unconcerned with cosmesis in veterinary dentistry. So it's a cosmetic concern. I think either staining or tertiary dentin. It doesn't bother your dog.
Okay. It's a patient of Dr. West living with myasthenia gravis and megaesophagus who cannot have dental chews or products, cannot have general anesthesia. What can I do? His back teeth are dark orange, 8.5-year-old golden doodle.
Brush. do everything you can do on the list. There are water additives. There are some food additives. Again, they're going to be much lower in terms of efficacy as monotherapies, but if you know that you are never going to anesthetize your pet, then we should be throwing the kitchen sink at them, so to speak, with everything that they can tolerate. So brushing, if it is at all possible, if there's not significant enough disease present already where it is very uncomfortable. And I guess, yeah, I would say do as much as you can, and be in discussion with your veterinarian about if there are negative consequences to not being able to have the professional cleaning. Hopefully it's a large enough doodle that maybe the teeth aren't so crowded that we're not going to be so predisposed to periodontal disease to begin with. But yes, it's always going to be kind of as much as you can come together with your veterinarian to create a treatment plan if anesthesia is completely off the table.
Okay, a few more. You guys have a lot of great questions, I have to say. What about the brushes, like the finger brushes, the thimble?
Finger brush, yeah, those are commonly marketed, especially for veterinary patients. And I think those bristles are generally thicker, so I think they're probably going to be more uncomfortable, and they're probably going to sweep in the gingival sulcus less effectively. So I think if you can get away from them, they're not my first choice. But if that's all you can work up to for whatever reason, then better than nothing. But I think really just a very soft child's toothbrush is probably cheaper and more effective.
Okay, another good one. Should you brush after the meal or wait until bedtime?
That's a great question, actually, because our brushing routine is very much after meal, irrelevant for dogs and cats because we're really only getting rid of that biofilm. The after meals component in human oral healthcare is because we are prone to caries or cavities, which are secondary to bacteria in our mouth making acidic byproducts from sharing our meals with us. So that's why we want to get as much food debris and bacteria and bacterial byproducts out of our mouths right after our meals, so that we're not feeding the bacteria that create the acid that eat our enamel. That's not common at all in dogs and cats. So whenever works for you is the best time to brush. Good question though.
Okay, wonderful. And about like 30 seconds, you're saying, yeah, if you can do it, yeah. Okay, let's see. There's a question about mouthwash or gels. Is that, yeah.
So I think the chlorhexidine products are probably, I don't think there are many other mouthwash options. If your pet doesn't mind it, great, but I haven't met one yet who didn't find it repulsive from a taste perspective. So I don't anticipate it going over all that well. But things like gels, other gel type products usually are going to have some of those chemical mediators that we were talking about. But yeah, those are, if you want to put that in your routine, great. No reason not to.
Flossing? Oh my gosh. Okay, we're getting crazy.
Flossing, I've seen a client attempt to train flossing, and I think yes, it would probably be great to really get in that sulcus, but I think in a patient that you can't rationalize with, I think it's probably more dangerous than helpful, because they're not going to know what you're doing, and if they jerk at just the right time, you're going to have a lasso around their tooth and rip it out of their mouth potentially. So I would avoid flossing, but kudos for your enthusiasm.
That's amazing. That's amazing. Okay, we're going to wrap it up. So thank you again, Dr. Ford. This was wonderful. Again, we'll be sending this out tomorrow along with a list of resources. Thanks to everyone so much for joining us again, joining us tonight. And everyone have a wonderful evening, and we will see you next time. Thank you. Thank you, Dr. Ford. It was wonderful.
Thank you very much for having me again.
Bye-bye.
Take care, everyone.